A very good morning and welcome to our session on the topic Common Skin Rashes in Children. We are glad to have Dr. Latika Uppal, Senior Consultant, Pediatric and Neonatology, Apollo Cradle Children's Hospital, Amritsar Unit, among us today to help us understand the topic and also the important details of it. The doctor will take us through the session more and more today. So stay tuned till the last of the session. If you have any questions, any doubt, post it on the comment section. The doctor will answer the questions. Questions questions will be answered at the last, so be there till the last of the session. It's a request. Now, doctor, you have the stage.
Right. Hi. Good afternoon, everyone. I am Dr. Latika Uppal. I am Senior Consultant Neonatology and Pediatrics at Apollo Cradle, Amritsar. So today we are here to discuss about common skin rashes in children. So most skin rashes are very easy to treat, sometimes through ice application or over-the-counter medications and products. But it's important to have them seen because your care provider, your doctor, can differentiate between the kind of rashes. Some can be dangerous as well. So we'll begin with few of the common skin rashes that we see in children. So the first is ringworms. Ringworms are they're not necessarily itchy. They are raised plaque-like structures, and it's basically composed of a fungus that lives off the dead skins, tissues, and hairs. It starts as a red scaly patch or a bump, and then the characteristic telltale sign appears later. It may or may not be itchy. Depending on its location, it's classified, for instance, tinea capitis, so on and so forth. It can occur at any place of the body. And it is contagious. It is passed on by skin to skin contact, and the treatments are broad spectrum antifungal tubes as well as oral therapy sometimes is needed. Second in this is fifth disease. So fifth disease is contagious. The most contagious phase is usually a couple of weeks before the appearance of rash. It starts with fever, flu-like symptoms, cough and cold can be there. It has a characteristic flushed cheek appearance, which is also known as slapped cheek appearance, and it spreads by coughing, sneezing through droplet infections. It is most contagious a week before the appearance of rash. So treatment is usually symptomatic therapy, plenty of hydration, and rest, lot of rest. Okay. Third in this is chickenpox. Now chickenpox, again, it comes as a prodrome which can last 10 to 14 days, sometimes even longer. There is fever, malaise, general body ache, there can be nausea, flu-like symptoms, runny nose, cough and cold. Later on, itchy rashes appear all over the body, and they appear in crops. They go through various stages of blistering, and then ultimately there can even be mucoid discharge from there. Serosanguinous discharge can also occur, and ultimately it caps off as a blister and sheds. So throughout this period till that last scab gets shed off, a person is highly contagious. Treatment is usually over-the-counter medications. For rest, there's plenty of, you need to do plenty of rest, a lot of hydration, paracetamol for fever. In very, very rare cases, if it is too severe, if the lesions are too severe, rarely antiviral therapy is prescribed. Impetigo. Now, impetigo is a very, very common skin rash in children. It is the causative agent is a bacteria. It creates red sores or blisters, which is usually present, can occur at any place, and it spreads more so, especially when the child itches it. They can break open, they can ooze, they can even develop into yellow-brown thickened crusts over the primary lesion. Sores then show up all over the body. It is highly contagious. It can, pass on from one child to the other. It is very common around the mouth and your nose. It is also, again, it is passed on by touching, coughing, sneezing. So again, symptomatic treatment is only required, Antibacterial tubes are given. Very rarely steroid preparations are also given to control the spread. The next in this is warts. Now, warts are caused by viruses. They cause painless bumps, which is very commonly seen on the hands. It is painless, it is harmless, it spreads again from one person to the other. It is present on the fingers of the hands. Usually, it's better to cover these with the bandages. The permanent treatment is cryotherapy. Laser ablations can be done. So, the most important thing is that you should not itch or attempt to, pull them off. Otherwise, it can, it can spread to other areas as well. Then heat rash or prickly heat. So prickly heat is very, very common during the hot and humid summer months. It is basically due to the blocked sweat ducts. So normally what people do is they keep applying powders. So powders again, they further lead to further blockage of the ducts, and it's a vicious cycle. So sometimes the rash can exaggerate. These are red or pinkish pimply eruptions, which are very common on the back, on the neck, on the shoulders. They are also seen behind the head. So topical calamine applications, plenty of hydration, loose clothing during summer, loose cotton clothing. This is very important, and maintenance of personal hygiene. So after playing, when you tend to sweat a lot, it's a good practice to bathe the child. So it's a self-limiting thing. Then comes contact dermatitis. So contact dermatitis is a very, very common entity. It is very commonly seen in children. So some kids react after touching food, soaps, say medications, plants. So there is a triggering factor in contact dermatitis. So common plants are poison ivy, then there is sumac, there is oak. So there are certain kind of weeds which lead to contact dermatitis. So it starts within 48 hours of exposure to the triggering or causative agent, and in severe cases the rash can spread all over the body. It can cause swelling, it can cause redness, and it can even cause large blisters which may ooze. Okay, it usually goes in a week or two. So it is very, very important to have the scene. Contact dermatitis, again, it can pass from one person to the other. So it is very important to have your care provider see the lesions. Then the commonest that all of us have heard a lot about, hand, foot and mouth disease. So it is primarily caused by a Coxsackie virus, okay, and it is very, very common amongst children. It spreads rapidly, it is highly contagious, it spreads from one person to the other. So it usually starts with prodrome of general body ache, malaise. They can be cough and cold. It may or may not be accompanied by fever. And this fever can be pretty high grade as well. Blisters usually appear inside the mouth, on the palms, even on the feet. Now, it may or may not be itchy. In certain cases, it even spreads to the buttocks, all right? And sometimes, even after the lesions have gone, what we note is periungual desquamation, the skin around the edges of your fingers, of the hands and the toes, very commonly in the feet, they continue to peel for weeks, even after the symptoms have disappeared. And it can even affect the nails of the toes. So treatment is symptomatic only. However, it is very important that during this period, avoid sending the child to school, because again, as I said, it is a rapidly spreading and very contagious disease. It spreads through droplet infection by coughing and sneezing. So it is a good practice if there are multiple children in the house. It's a good practice to isolate the child, give plenty of hydration. Now it's very important to not use over-the-counter medications. For fever relief, paracetamol alone is enough. Make the child wear loose clothing, can apply topical emollients and calamine to make the child feel comfortable. Have your care provider see the lesions as early as possible. and the symptoms can last a week to 10 days. In rare cases, it goes beyond also. Then comes eczema. Now, eczema is a very, very common skin condition, and usually atopy, allergy, runs in families. So, if there is a family history of itching or atopy or allergy, so family history of allergy can manifest in any form. It can be, in the form of cough and cold, in the form of intolerance to a particular agent. For instance, many people have lactose intolerance or wheat allergy. So eczema can be triggered, family history plays a very important role, and it can be triggered at any age. It's not necessary that it has to be present at birth or since birth. It can occur during puberty, prepubescent phase, in developmental stages, for instance, pregnancy. So, adolescence, under stress. So, eczema can occur at any point in time. It's very common, as I said, in allergy prone children. This is basically due to a very sensitive immune system which triggers off at the brink of a hat. So, any agent which can trigger this, eczema, that can happen at any point in time. So basically, these are raised plaque-like lesions with itchy skin, and there is intense itching which is present. Sometimes the lesions can be scaly also. Atopic dermatitis is a variant. So the treatment of eczema is basically plenty of hydration. Immediately you have to dry the child after bathing, and it's better to use products which lock in the moisture. So maybe the last rinse, you can add a few drops of oil and pour it on the baby's body and immediately dry. Apply a good emollient cream to keep that area well hydrated. Sometimes you require more medications to control progression of this disease, and again, that's where it is very important to have it seen by your care provider. It also many a times gets confused with psoriasis. So do not attempt to self-treat these conditions. One test which can really help in diagnosing what particular agent is causing or triggering the immune system is your allergy panel. So comprehensive allergy panels are a group of tests which usually help in these conditions, and the triggering agent is identified, and you need to avoid that in your diet or in the environment based on the reports. So mast cell stabilizers are also prescribed to and antihistaminics to control and contain the itching. Hives. Now, hives are very, very common, and they can appear for a few minutes and last up to weeks as well. So these are itchy and burning welt-like lesions. It can be caused by anything. Could be a food item, could be a medication, could be a cosmetic agent, all right, and even drugs such as penicillin, aspirin, they can even trigger. So food, there are many people who are allergic to a couple of food items. For instance, shellfish allergy, eggs, then your milk, things like that. So people who are allergic to certain items, hives can trigger off very easily. So it can even be seen during extreme heat or cold. Even streptococcal throat infection can lead to hives. So it can show up anytime, it can show up anywhere, and it can last for a few seconds to minutes, or can even go up to weeks. If hives come with breathing issues, if you feel that there is swelling of the lips involved, or if there is any kind of breathing problem, then it is a medical emergency and it has to be seen immediately. Treatment is usually antihistaminics. In cases who are severe allergic, or who have a family history of allergies, there is a device which is known as EpiPen, which abroad it is very freely available. So it's for home usage. So any kind of rash which is accompanied by breathing difficulty becomes an immediate medical emergency, and it should not be ignored. Then scarlet fever. So streptococcal throat infection, which is accompanied by a rash, is known as scarlet fever. So the characteristic of this disease is sore throat. There is pain in the throat, hoarse voice, itchy, murky feeling of the throat. There is fever, there is headache, malaise, fatigue, general body weakness. Then neck glands may be swollen in scarlet fever. After 1 to 2 days of these prodromal symptoms, rash appears with a sandpaper-like texture, and it usually lasts for 7 to 14 days. After 7 to 14 days, the rash tends to rub off or tends to disappear. It's a highly contagious disease, although a little obsolete now. But again, the child has to be isolated and give plenty of hydration, cool, comfortable clothing, and paracetamol to control the fever. Roseola or sixth disease. Now, roseola is a mild illness. It's seen in young children around 6 months to 2 years of age. They are more likely to get it because of a developing immune system, and as I said, it's a highly contagious disease. It is very rare to get roseola after 4 years of age. However, one can, but it's a rare entity. It starts usually with a runny nose, cold or a runny nose, and it is followed by a few days of very high grade fever. So it is in roseola, the fever is so high grade that it can even trigger off febrile seizures. Okay, so the fever is usually followed by small blister like pink raised bumps. It first appears on the cheeks and the chest and the back, and then it spreads to the hand and feet and the extremities. So again, plenty of hydration is very important. It is very important to not give over-the-counter therapy. For controlling fever, only paracetamol is to be used. Make the child, keep the child in an isolated room, avoid school during this time, and plenty of hydration. It's a good practice to give hydrating fluids like coconut water or plain water, fruit juices, plenty of hydration. So next in this are salmon patches. Now salmon patches are nests of blood vessels that appear as small pink or flat marks which are present on the skin. So you may notice it on your newborn. It is usually present above the eye or in the center of the forehead, which is known as angel's kiss. Sometimes it's present on the nape of the neck. So these are known as stock bites. These are harmless self-limiting lesions, and they usually tend to disappear by 1.5 to 2 years of age. Some may not fade. However, no treatment per se is required. Then comes port wine stains. So port wine stains are progressive vascular malformations of the skin which are related to the blood vessels. They are made out of dilated capillaries, all right, and they tend to get darker and also tend to increase in size as the age advances. So these are highly susceptible to bleeding. So you need to be careful that the child doesn't injure that particular part. Color may change from pink. Initially it starts as a pink lesion. It may change to red and even reddish purple. They tend to even become fleshy over a period of time. And in adult life, they can be nodular. So the treatment is basically oral prednisolone. Laser and cryotherapy later on can be used, and to cover the defect of the skin, grafts are applied. Then comes strawberry hemangiomas. So these are present on the face, scalp, chest, could be there on the back. These are red or purple lesions, and they are raised. They even have very well defined edges or borders. All right, they may not be necessarily present at birth and may appear after a few weeks. They grow rapidly and may disappear by 9 years of age. So if they tend to persist, then again laser therapy or skin grafting can be done to cover these lesions. Now the last amongst these is the diaper dermatitis or your nappy rash. Now, nappy rash can be bacterial, it can be fungal, it can even be a form of contact dermatitis. So, it is very important in order to prevent nappy rashes. It is very important to preferably use indicator based diapers so that you know when to change the baby. So when a baby is, when a nappy is there, suppose a baby is past urine or a motion, and in a soiled nappy, the baby tends to lie. So the skin comes in contact with the excreta, the fecal or the urine, the excreted products containing ammonia. So that can damage a baby's delicate skin and it can lead to nappy rashes. Now, usage of wipes can also lead to dermatitis in babies, and strong agents, there's a very common practice where mothers tend to use Dettol for sanitizing or sterilizing their baby's clothes. So if any of these, or detergents, strong detergents, if it's not thoroughly taken out of water and any of this remains, it can cause rashes all over the baby's body. So it's very important to use mild products which are baby safe, recommended by a pediatrician or your skin specialist. For massage, you can use milder oils, like coconut is an all season oil. Avoid using any scented or perfumed products. Avoid the use of wipes or any strong detergents to clean the baby's clothes or skin. Avoid the application of milk and butter and things like that. And there is another very common practice wherein a ball of flour, आटे का लोई जैसी बना के बच्चे के body and face पे rub किया जाता है in order to remove the hair. So this can again lead to infection, it can lead to dermatitis, it can even lead to बाल तोड़ हो सकता है, which can cause blisters on the skin. So all of these practices should be avoided. So I hope I've been able to touch upon most of the common skin rashes in children. I'd be happy to take up questions if any. So since there are no questions, I hope that you enjoyed this session, and I hope I have been able to cover most of the topics. So thank you very much for tuning in today. I thank you once again. Have a good day.